You know, I read that prices that the government pays for Medicare services are up 58% over the last 10 years. You say this might be part of the reason. Is this a racket?
It's a total racket. I mean, it's the fox guarding the henhouse, right? The AMA is conducting these surveys with their own doctors, and they never err on the side of saying it's too little work. They always err on the side of saying, oh, this is so much work, this procedure is so challenging, we have to be reimbursed a lot for it.
Dr. Scott, well, we talked about this last week, and you said that how some of this pricing gets set makes no sense at all. Give us an example.
Well, the pricing gets set based on an assumption about the, quote, intensity of the work required to do certain things and also the time it takes and some measure of the overhead costs. So basically it gives an incentive for higher reimbursement for procedures. So you can do a procedure like removing an ingrown toenail, literally, and get paid more than you would for spending a half an hour counseling a patient. And so it incentivizes doctors to try to do more procedures and try to chart so they can then code for more things.
You know, I don't know any other part of the American system, Ovik, where, you know, Colgate-Palmolive, when it's deciding how to price toothpaste, it doesn't say, well, let's just put this price on it. They go out in the marketplace, they see what the marketplace bears. That's how that works. Why isn't medical pricing the same way?
Well, this was all developed by a Harvard economist named William Shao in the 80s, and it was actually enacted by the Reagan administration and the Bush administration as a way of trying to bring Medicare costs down. They were like, Medicare costs are going out of control.
Work?
No, it didn't work. I mean, it basically, costs kept going because people gained the system. And one good example of how this distorts the way people treat patients is take gastroenterology, so people who treat GI issues. One of the biggest public health problems in GI specialty is hepatitis C, hepatitis A, things like that. But doctors don't get paid treating those patients. What they do get paid doing is colonoscopies. So all these GI docs are doing colonoscopies all day because they get paid tons of money by Medicare to do that. They aren't treating people with hepatitis, which is a much bigger public health problem.
And they want you to have a colonoscopy every 20 minutes, as far as I can tell. And then they can cost thousands of dollars. It's unbelievable. Dr. Scott, to you, I want you to respond to what the AMA had to say about these codes, because we got a statement from them last week. They say CPT, that's the codes we're talking about, is one of several sets of codes used within the healthcare system and was created to provide a common language that accurately and consistently describes medical, surgical, and diagnostic services, that is, provided by physicians and other health professionals. Medical doctors and other qualified health professionals write the CPT codes, and hundreds of experts provide input. Does that really explain what's going on here?
Well, basically the federal government punted to the physician organization, to the American Medical Association, the job of coming up with how they're going to pay for all the discrete services that doctors deliver. And the reason they did that is because they tried to cap what doctors were paid, and they said, okay, here's a fixed pie of money, you doctors fight over it, figure out how you're going to carve it up. Now, the caps on what physicians are paid overall, and I'm a physician, never were honored. So that what doctors are paid overall, that pot has continued to grow more than what they assumed.
Grow and grow.
Centers for Medicare doesn't want to get involved in this. They would rather have the doctors fight this out. And what happens is the specialists who do more procedures have more sway in this process, so they end up overcompensating procedures.
Well, let me just, this blew me away. So it's not just that the AMA ends up setting, prices basically by consulting with doctors, but they also make money off of this. They make $72 million, which is far more than they get from their member dues. $72 million from this. Basically, the federal government, Uncle Sam has said, here's a monopoly. You set these prices. You make this money.
And there's a reason for that.
How do they make that money?
The reason why this all happened is because the AMA used to be the biggest bulwark against socialized medicine. And so when Lyndon Johnson was trying to get Medicare and Medicaid through Congress, he basically said, we're going to let the doctors charge whatever they want, and that way the AMA won't oppose Medicare. And that's why Medicare costs have grown out of control.
So it's sort of a bribe to get the deal done.
So basically that's why they let the AMA be in charge of it, because they don't want the AMA to get mad, because if the AMA is okay with it, then the government can still expand.
Oh my gosh. So it was a way of getting Medicare in place. Scott, I need your reaction here. I know you have serious questions about this. What is the biggest problem with this system?
The biggest problem is it doesn't value physician services on the basis of how a patient would value it. It values them on the basis of how a doctor would value them. And it also incentivizes the wrong kind of behavior on the part of us physicians. It incentivizes spending a lot of time with the chart trying to write long notes to justify the codes. Because that's how you're going to be reimbursed and that's how you're going to be audited by Medicare.
But doesn't this also incentivize doctors to increase prices? I mean, at the end of the day, this is just one big fat check to the medical establishment to increase prices every single year. I mean, if you're going to the AMA, and the AMA in turn is going to trade associations that represent various specialties, Ovik, doesn't that guarantee escalating prices as far as the eye can see?
It does to a degree, and that's why the so-called SGR, the price control, all these things were brought in the first place. Because it's like you're at a dinner with 10 other people, and at a restaurant, and you're going to split the check evenly. So every person at the restaurant has the incentive to order the most expensive thing on the menu because they're going to split the check equally. And that's how doctors are. Doctors have the incentive to bill because there are these price controls, but the price controls don't affect them directly. They affect the overall system. They're global budgets.
Well,
so it's a big mess.
It is a big mess. And yeah, Dr. Scott, you got something you want to add in here quickly?
I was just going to say, as a physician, you know what codes you can bill, and you know which are the higher paid codes, and doctors are very cognizant of that, and sometimes, and that drives the wrong kind of behavior in terms of the services you're going to perform on behalf of the patients.
Well, I think it's outrageous, and I hope that our viewers will email us, GerriWillis.com, to send us a quick email, get in touch with us, let us know what you think. I am shocked that this is the way this country does business. Ovik and Dr. Gottlieb, thanks for coming on tonight. Great job, as always. We'll be